How do you choose a method that's best for you? First, it's important to think about, why are you interested in learning fertility awareness-based method? Are you a 14-year-old girl and you just want to monitor your health and maybe understand when to expect your next period? Perhaps you're dealing with symptoms like painful periods or irregular cycles and you want to get at the root cause of those. Perhaps you're married and in school and don't want to have a baby right now and you're looking for a healthy, safe way to avoid pregnancy. Or perhaps it's time for you to grow your family and you would hope to achieve a pregnancy. Again, using a fertility awareness-based method and helping people to identify when they are fertile and when they are not can allow couples to use these methods to both prevent and achieve pregnancy. And using a fertility awareness-based method can allow women to monitor their health and work with trained clinicians to address potential underlying health concerns. So that's the first consideration. What is your why? Why do you want to learn a fertility awareness-based method? Next, you want to consider, what signs do you want to monitor? Maybe you don't want to monitor any signs. The thought of tracking cervical mucus or taking to remember to take your temperature seems too much, and you have regular cycles and you just like to track your days. That's totally acceptable and an option for you. Perhaps you are interested in monitoring cervical fluid because you've come to appreciate how it can change under the influence of estradiol or progesterone, and that's of interest to you. Maybe you like to record your temperature because you like to plot those numbers and see the data points change on a day-to-day basis. Some women like to track their urinary hormone measurements and put the test strip in the monitor and have the monitor indicate whether or not you're in a high phase of fertility or if you've reached peak fertility. And maybe, like many women, you want to be able to track 2 signs. So again, depending on which signs you want to monitor will help you determine which of the modern fertility awareness-based methods may be best for you. Another important consideration is, what are your cycles like? Do you have very regular cycles? If so, if your cycles range between 26 to 32 days, you can use any of the modern fertility awareness-based methods. It's important to note with the standard days method, that is a requirement that your cycles be 26 to 32 days. But what if you have irregular cycles? Perhaps you've been told by a physician or nurse practitioner, well, if you have irregular cycles, you can't use fertility awareness-based methods. And I would beg to differ. In fact, most of these modern methods, especially those in which women observe their signs of cervical fluid secretions and/or temperature or urinary hormones, can be very helpful, not only at helping women to track her cycle, but even to potentially get at root underlying causes and help you to understand, why are my cycles irregular? Maybe you're not having a cycle at all. Maybe it's been months, in which case learning to observe signs can be an early indicator to help a physician trained in these methods to help you get at what is going on. The cycle and ovulation is a sign of health. So if you are not having regular cycles, this is an indication that there may be underlying hormonal or structural or anatomical issues that should be addressed. So it's not enough to simply take a pill every day to give yourself a regular withdrawal bleed. As a woman, it's best to learn what is going on with my body and getting at the root cause so you can work with clinicians to treat the underlying issues that may be affecting your cycle. Another consideration when choosing an FABM is, what factors are most important to you? Perhaps you're a college student and you don't really have extra income, to spend on test strips or monitors. Maybe you want something that's really easy, just tracking your days if you have very regular cycles. Perhaps you're looking for a method that's very effective in terms of preventing pregnancy because you have serious reasons. Maybe you're somebody that wants to be able to learn a method virtually, and so you want to see what methods have virtual instruction available. Hint, most methods these days do have virtual instructors available, but maybe you'd like to meet with somebody in person. Unfortunately, there are still far too few fertility educators in the United States and around the world, so you may not always be able to find somebody trained in the method of your choice who is nearby. But you can certainly visit the factsaboutfertility.org website page and check out our physician, clinician, and educator directory to try to locate somebody near you. And finally, perhaps you like the use of technology, whether it's in checking your signs, like your urinary hormone measurements, or whether or not that method has an app that you can use to track the cycle. I know I already mentioned apps, and tried to give a buyer beware alert that many apps out there are not great. So if you're learning a method from a trained instructor, I would certainly encourage you to ask your instructor, what app do you recommend and or is affiliated with the method you teach? So for example, the 𝗕𝗁𝗂𝗹𝗆 teaches the symptothermal method, and they have the Cycle Pro Go app. So I would recommend you use that. If you're learning the Billings ovulation method, they have an app called NFP charting. And the nice thing about using apps that your instructor recommends is they may actually be able to access that data as well to be able to help you when you have questions about your observations. This slide is simply to show, regardless of your situation, whether you have limited time and resources, if you have irregular cycles, whether or not you want a method that offers a double check, perhaps you need a model that has medical applications because you're struggling with cycle-related health issues. Maybe you have an irregular sleep schedule. Perhaps you're interested in online learning. Maybe you're a breastfeeding mom. Regardless of your situation, this slide is designed to show you that there are many methods available for you to choose from. So for example, if a woman has irregular cycles, an irregular sleep cycle, and is interested in a double check method, she may be interested in using Marguerite because that fits all of those criteria, as you can see here. Perhaps you have limited time or resources, and irregular cycles and an irregular sleep schedule. In that case, Billings may be the best choice for you. Perhaps, again, you're interested in a medical model because you have underlying health issues, in which case Creighton and FABM can all be used. Finally, I just want to conclude that fertility awareness-based methods are unique and provide an advantage to conventional forms of family planning because these offer a healthy option. With modern fertility awareness-based methods, women work with their bodies. They learn how to observe their biomarkers to identify when they may be fertile and when they're not, and together with their partners can choose to modify their behavior. They do this without disrupting her cycle or using drugs or devices that in any way would suppress the way her body is designed to function normally. So with fertility awareness-based methods, it offers a healthy choice for women to monitor their health, manage underlying reproductive issues, and work with their partners to plan their families. I do want to emphasize again that it is always best to learn these methods from a trained instructor. Most instructors may only be trained in one method, and you may find that one method works for you for a time, but due to a change in your life, another method may be a better option. We invite you to visit the factsaboutfertility.org website and sign up for our webinar, The Facts About Fertility Explained, where we go into much greater detail about each of these methods and provide resources to find an instructor in the method of your choice. Here's an example, and these are available on our website. Again, we invite you to visit our website, factsaboutfertility.org, click on Learn More, and scroll down to our Physician, Clinician, and Educator directory. These links are all available there, and hopefully through this presentation, you have a better idea of how to choose what method may be best for you. Once you've made that choice, we encourage you to find a trained instructor through any one of these websites. One last thing, Facts has recently developed a shared decision-making tool which provides a method-by-method comparison of these modern methods. If you're interested in checking that out, please again visit our website where this tool will be made available via our shop. Thank you so much. For more information, please feel free to reach out to us. If you would like to invite a Facts speaker to speak to your community, please email us at speaker@factsaboutfertility.org.